Hello everyone and welcome to my channel. I'm Dr. Laura, a family doctor with more than 25 years of experience helping men like you stay healthy and live better. Today we're talking about something very important for older men, but often overlooked: prostate health. I know it's not the most comfortable topic, but believe me, this talk could make a big difference, maybe even save your life. So, grab a coffee, get comfortable, and let's discuss why looking after your prostate is so crucial as you get older. Let me start with a story that stayed with me for years. A patient of mine, John, was a 62-year-old retired firefighter, strong, proud, the kind of guy who never missed a gym session. He came to me one day looking uneasy. For months, he'd been waking up 3 or 4 times a night to use the bathroom. He brushed it off as just getting old, but his wife noticed he seemed tired, irritable, and frankly not himself. After some tests, we found John had an hyperplasia, an enlarged prostate, a condition called benign prostatic hyperplasia, or BPH. Left unchecked, it was starting to affect his bladder and even his kidneys. John's story isn't unique, but it's a wake-up call. Ignoring small symptoms can lead to big problems down the road. Here's the truth. Society often tells men to tough it out or that talking about health issues like this is somehow unmanly. I'm here to challenge that myth head-on. Caring for your prostate isn't a sign of weakness, it's a sign of strength. It's about taking control of your health so you can keep doing the things you love. Whether that's playing with your grandkids, hiking with your buddies, or enjoying quiet evenings with your partner. Prostate problems don't define you, but ignoring them can steal your vitality. Let's bust a few myths right now. First, many men think prostate issues only happen to really old guys. Wrong. Problems like BPH or prostatitis can start in your 50s or even earlier. Second, some believe that prostate symptoms are just a normal part of aging, so there's nothing you can do. Not true. While aging affects the prostate, there are proven steps to manage and even prevent complications. And finally, the big one: if I feel fine, I don't need to worry. Gentlemen, many prostate issues, including prostate cancer, can be silent for years. Waiting for symptoms to scream at you is a risk you don't want to take. So, what happens if you neglect your prostate? Let's break it down with some straightforward science. Here are 4 serious consequences of ignoring prostate health. 1. Urinary problems. An enlarged prostate like John's can press on the urethra, the tube that carries urine out of your body. This leads to frequent trips to the bathroom, weak urine flow, or even trouble starting urination. Over time, this can strain your bladder, causing infections or even permanent damage. 2. Kidney damage. If urine can't flow properly, it can back up into the kidneys. This increases the risk of kidney infections or even kidney failure, a serious condition that might require dialysis. I've seen patients like Robert, a 67-year-old who ignored his symptoms for years, only to end up in the hospital with kidney issues that could have been prevented. 3. Sexual dysfunction. Prostate problems can affect your intimacy. Conditions like BPH or prostate cancer treatments can lead to erectile dysfunction or reduced libido. I had a patient, Mike, who felt embarrassed to talk about this with his wife. It created tension in their marriage until we worked together on solutions that helped him regain confidence. 4. Prostate cancer risk. Prostate cancer is one of the most common cancers in men over 50. Early on, it often has no symptoms. Ignoring routine checkups can mean missing the chance to catch it early when it's most treatable. I'll never forget Tom, a 70-year-old who skipped screenings for years, only to face a tougher battle because his cancer was caught late. The good news: you're not powerless. Prostate issues can often be prevented or managed with simple science-backed steps. Here are 3 practical things you can start doing today. 1. Get regular checkups. If you're over 50, talk to your doctor about a prostate-specific antigen, PSA test, and a digital rectal exam. These screenings can catch issues early. John, my firefighter patient, started getting annual checks after his diagnosis, and he's now managing his BPH with medication and feeling like himself again. 2. Eat for your prostate. A diet rich in fruits, vegetables, and healthy fats like tomatoes, broccoli, and fish can support prostate health. Lycopene found in tomatoes has been linked to lower prostate cancer risk. Cut back on red meat and processed foods, which can increase inflammation. Mike, the patient who struggled with intimacy, found that improving his diet boosted his energy and confidence. 3. Stay active. Exercise improves blood flow, reduces inflammation, and helps maintain a healthy weight, all of which benefit your prostate. Even a brisk 30-minute walk 5 days a week can make a difference. Robert, my patient with kidney issues, started walking daily and noticed better urinary flow within months. Gentlemen, you're not alone in this. Prostate issues affect millions of men, but they don't have to define your life. I've seen patients transform their health and their outlook by taking small, intentional steps. You deserve to feel strong, vibrant, and in control. So, here's my challenge for you. If you're ready to take control of your prostate health, drop the number 1 in the comments. If you're unsure or have doubts, just comment why and let's talk. Your experience matters, and sharing it could help someone else. For extra tips and a free guide on foods that support prostate health, check the pinned comment below. If this video helped you, hit the like button and share it with a friend. It might change their life. Don't forget to subscribe and tap the bell so you never miss our next video on staying fit and healthy at any age. Thanks for trusting me with your well-being. Let's keep talking. You're not alone in this. You've got this, and I'm here to support you. Until next time, take care.